Hi, everyone. Lexi here from Lexi's Wellness Warriors, and you also know me as part of the Muscle Check team. I'm thrilled today to be chatting with Kim Umphrey. You've met her before. She's also part of our Muscle Check team. She is a registered massage therapist, as well as a certified holistic nutritional consultant with Sphere of Physiotherapy and Massage. And today we're going to be chatting about arthritis.
Hi, thanks for having me back and letting me geek out with you again.
Yes, this is perfect. And arthritis, I mean, I know myself, I've been dealing with it for a long time, and especially this time of year when it's so cool, it tends to aggravate and exacerbate things. So I can't wait to hear what you're going to share with us today.
Yes. So first of all, why does arthritis bother us when the weather changes? Part of it has to do with the cold. The cold certainly influences arthritic pain and swelling and such. But part of what happens is arthritis typically happens in the joints. And inside the joint, you've got, first of all, the joint is typically covered in a little capsule which holds fluid. That fluid is necessary because it lubricates. It's like oil, lubricates joints whenever you move. However, when the barometric pressure changes, that changes the pressure inside that little capsule. So if the pressure outside drops, then that will change the pressure inside that capsule there, and that will influence that arthritic pain as well. Now, people debate what's better, hot or cold, hot or cold. Really, it's up to you. Each person's body is a little bit different, and some people prefer heat. I know me personally, I've got bad arthritis in my knees. When it's acting up, I need heat, preferably deep saturating body heat, or that infrared heat I find helps. But cold, don't put me anywhere near cold because that will make it worse and I will hurt. Other people, they love the cold, and cold can be good because it does reduce inflammation. If you do apply heat, don't apply too much of it because that can increase inflammation, and inflammation is the heart of arthritis. Self-care. You basically, if you're dealing with arthritis, you need to have a number of tools in your toolbox, and you rotate through a base level, and then you've got your heavy hitters that you pull out when you need it. This is where Muscle Check is absolutely incredible because it is a natural anti-inflammatory. You can apply it only specifically where you need it. It's all natural, so it's actually not going to interfere with your normal body chemistry or interfere with other arthritis medications either, which is really important, especially when you're using a home remedy. And basically all the ingredients are chosen specifically to be healing and anti-inflammatory in nature. So this is why it is so incredibly fantastic for arthritis. Plus, because it actually penetrates through the skin barrier, doesn't just sit on top, it can be deeply effective and actually do something, okay, rather than just feel good for 20 minutes. And this is where it outshines anything I, as a massage therapist, have seen. And this is why I believe in it.
and you know, you mentioned a good point. I think that that's the number one thing when we're out and about with the public is we get asked, well, why is yours different? And that's exactly it. I know, you know, having run the gamut and tried different things over the last almost 30 years now of different pain relievers and things, that's exactly it is, you know, if you're someone who is taking medication already for whatever condition you may have, knowing that you're not putting another drug into your body, knowing that this actually penetrates deeply enough and actually gets to where it needs to work, right? And you brought up a good point too about I have a chronic pain toolkit. I have my Hex infrared heating pad in there. I have Muscle Check in there. I have my cozy socks. I have things that make me feel good. And I think that it's really important as well as, you know, we have certain go bags or things for certain events. And I think it's important mentally and also physically to have, you know, when you're experiencing a flare, having a kit or something that you can just go to grab.
I've got tons of these little bottles around, which I keep one in my purse, one on my computer desk, one at work. One in my bag that when I pack it for overnights, I just keep it in there.
Yeah.
Now, unfortunately, I happen to be allergic to menthol and to the NSAIDs,
Yes.
which means I actually cannot use muscle check, which is heartbreaking for me because I know it works so well.
Mhm.
I also can't use ibuprofen, Advil, any of those things. So
Mhm.
what do you do? I mean, personally, the only thing I can take is acetaminophen or Tylenol. So what do you do outside of that? So this is where some of your other comfort measures come in, such
Mhm.
as a hot pack or cool pack.
Mhm.
Um, Doing things such as magnesium. And this is where I'm excited to hear that Muscle Check is actually developing a magnesium ointment or a lotion. I can't wait to try that one because I'm like, yes, I want this one.
Mhm.
Magnesium will work, as I mentioned in our previous chat, it'll work by helping the muscles to relax and by lowering your stress levels
Right.
because anxiety um, increases your response to pain. So it makes the pain that's there stronger. It's not that the pain is more, is that you feel it more when
Well,
you're
I
anxious.
I think your body, for myself anyway, I can feel it. If I'm
Mhm.
anxious, my body automatically tightens up. I
Yeah.
automatically draw forward, kind of tighten up, and I can feel that tension, right? So to
Hmm.
kind of remind myself, okay, I got to release a bit too, right? It's
Yeah.
so important because you're
Yeah.
right. And there's that mental part of it too, right? Is depression can go or does go hand in hand. Many research studies have shown that it goes hand in hand with chronic pain. And it's hard to sometimes when you're in it, you don't realize. So I think there's so many levels to it as well. It's not just the
Hmm.
arthritis per se, but it's everything that encompasses it as well, right? All the other things.
Yeah. Yeah. And take a break from it. Go get a massage,
Yes.
right? And whatever style of massage feels good to you. If you're in the middle of an arthritic flare up, you
Mm.
may not want that deep tissue, heavy massage. But you can always tell your massage therapist, look, I'm feeling tender today. Can we go a little gentler?
Mhm.
And that just getting that break, even if it's a very gentle, light touch massage, if it helps you relax and take a vacation from the pain for an hour,
Mhm.
that can be worth it and
Mhm.
just give you that mental break so that you can then go back and, okay, I can handle this now.
Yeah, definitely.
Yeah.
And you mentioned too, it's different for different people. Like I know
Mhm.
when it's heat, it's funny. I like the heat. I like heat. I don't like extreme heat. To me, extreme heat's
Yeah.
like being above. But I
Yeah.
find in the summertime when it's hot, cool helps me. And in the
Hmm.
winter, of course, when it's cold, the heat helps me. But it's
Yeah.
finding that happy balance. And also the fact that, again, as you mentioned, everybody's a little bit different. We may have the same thing. We may both have arthritis, but our bodies, again, might respond slightly differently to things. So I think that that's part of their journey as well, is finding what works for you and having that toolkit, right? Or that
Yeah.
get ready for those instances. And that way, okay, this is what I need.
Hmm.
And also exposing or telling our loved ones about it, because I think that the one of the things that people forget about is our loved ones who see us in pain and they're not really sure what to do, right? And
Yeah.
it stresses them too. So if we've got something ready and they know, oh, right, I'll get you your muscle check, I'll get you your this or that, whatever, it's already there.
Yeah.
Kind of helps them help us, because I think that there's nothing worse than seeing someone in pain and not being able to do anything about it and feeling
Yeah.
so helpless. So at least, having that as well helps them out too. Yeah.
Yeah. Yeah. And you already mentioned the warm, fuzzy socks. Some
Mhm.
people have like a fuzzy blanket that some people prefer that kind of tight wrapped blanket feeling, that snuggle feeling.
Mhm.
Some people don't. So it really all depends on, and if you're suffering with arthritis, you already have tools in your toolkit,
Yes.
even if you don't realize it.
Yes.
And you just subconsciously start developing them.
Mhm.
Um, there are a million and one different ways of dealing with chronic pain, but these are just kind of some of the top few and some of my favorites to fall back on,
Awesome. That's
both
great.
for myself and for my clients.
And what do I find for me, like my hands, that feeling, kind of the only way I can describe it is feeling like an overstuffed pierogi or a
Yeah,
sausage that's stuffed too tightly with the hands. Like I know for myself, I do little movement exercises. Is there
yeah.
anything that you kind of like as your favorite little exercise for hands and fingers when we wake up in the morning or throughout the day to kind of help us
Just
relieve?
that you know, I know in the first thing in the morning, any part of the body can feel like a badly oiled, squeaky door. And
Yes.
basically it's just that, you know, just get the movement going that pumps the lymphatic fluid around and
Mm,
helps to pump it out of the hands and or out of, you know, and into the general part of the body instead of the joint where it's affected. Just
mm,
start with gentle movement and just kind of slowly increase a little bit more
mm.
pain. You know, it may be a little achy, but you don't want any actual pain with that movement.
Right.
So even if it's just doing this at first, start with what you can do and it'll gradually slowly unstiffen and you'll be able to do more. And then it'll loosen up as you go.
So I know for myself, I wake up in the morning and I do my stretches 3 to 5 minutes, and it works really well just to kind of warm things up before I get moving. And the
Mhm.
same with kind of twisting side to side, but just a short little warm up I find makes a difference. And even throughout the day as I'm working, I will get up and give myself breaks because I work from home, and stretch and move around and make sure that I'm
Mhm.
getting that kind of motion,
Motion is lotion.
right? So yeah,
Yes.
awesome. Awesome. Okay, well, I think if we've got any questions, if anybody out there who's watching our video, if you could please let us know what you thought of it. If you have some things in your chronic pain toolkit or in your arthritis toolkit that you'd like to share, please feel free
Yeah.
to comment. Any
We can
questions?
always learn. We can always learn
Yeah.
from each other. Yeah.
Well, and that's the thing, right? It's that community and knowing that there are people
Mhm.
out there who may have the same thing as you, but may have different strategies. And so learning from that, and any questions at all, don't hesitate to reach out. And until the next time. Thanks again, Kim.
Geek out.